On May 23rd, the I-Team's reporting began with two Maryland residents telling the I-Team their Medicare coverage paid for $6,200 in COVID tests they never asked for or wanted.
I said no, 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 and I hung the phone up.
And the number of people kept growing.
Never ordered a COVID test.
By May 26th, it was 66 people, reporting more than $57,000 in taxpayer money. As more viewer messages poured in, we took the issue to Maryland's member of Congress, best equipped to address the issue. I now have over 125 viewers who have reached out and said that they've received COVID tests in the mail that they never ordered, that their Medicare was billed for it, adding up to over $120,000. Senator Ben Cardin chairs the Senate Subcommittee on Health Care. What have you heard from Medicare about this, if anything at all?
Well, this is something that was just recently brought to our attention. There are sanctions that can be imposed against providers for doing that, including criminal sanctions.
The 11 News I-Team obtained this U.S. Department of Justice indictment, criminally charging two people in Florida for conspiring to defraud the United States, accusing them of illegally using people's Medicare numbers to purchase COVID tests they never requested. The amount the DOJ says the two people tried to bill Medicare, more than $8.4 million. So what does it look like here in Maryland? Here's the most up-to-date numbers the I-Team has received directly from viewers. So 128 people have reached out directly to us. They've received 1,354 unwanted boxes of COVID tests. With Medicare paying about $96 per box, taxpayers are footing the bill for roughly $130,000.
By the time we got the third set of tests, your article had come out on the news about the test and the fraud and everything.
Ann Meckel says she never ordered COVID tests and never gave out her Medicare number, but she got a dozen boxes of them in the mail anyway. When she saw her Medicare was charged more than $1,100, she called to ask if she could be given a new Medicare card.
I was told my Medicare number is my number for life and that they do not issue new cards.
When asked about Meckel's claims, the Centers for Medicare and Medicaid Services replied in a statement, CMS is investigating consumer complaints about unsolicited over-the-counter COVID-19 tests arriving in the mail. CMS will notify a beneficiary if it has been determined that their Medicare beneficiary identifier has been compromised and, in that case, will replace a beneficiary's Medicare card with a new MBI.
That's not what they said last week. What they told me last week is my Medicare number is my number for life.
Do you feel safe having your current Medicare number?
Not really.
Why?
No, because this is not a number that should be out there. You know, this is for my Medicare, for my health reasons, not for somebody else to use for my health reasons.
Senator Cardin is less worried about Medicare numbers.
The issue is improper billing, and that's our government's responsibility, not the individual's responsibility. Let us follow up.
But he is focused on fixing the root cause for Maryland residents. If what these Maryland residents are telling us is true, do you want to see the Department of Justice take action in Maryland?
Oh, absolutely. If there's fraud, we want to follow up. That's inexcusable. So there is an abuse. If there's fraud, I want to make sure they're prosecuted.
Truly is scary that it's easy enough for other people to access. I was a teacher for 40 years, and I always believed in the best in people. But this does make you think twice about what some people are doing.
And from the information gathered from viewers, we've now learned that the packages have come from at least 8 states across the country. If this has happened to you, you can find out how to report it right now on the WBAL TV app. For the 11 News I-Team, I'm Tolly Taylor.